Well, with heat indices or the feels like temperature up to 115 degrees, it's nothing to fool around with. It's especially dangerous for the most vulnerable in our community. News 8's Mal Meyer joins us now with how the heat is impacting that population.
Mike, heat waves are a leading cause of extreme weather-related deaths in the nation, according to the Centers for Disease Control and Prevention. But certain populations, like people with disabilities, the very young, or the elderly, may have higher risk for heat-related illnesses or death. And that's why health experts say it's so important to help the most vulnerable. Every single day, Mobile Meals of La Crosse delivers hot and cold meals to people with disabilities and the elderly.
This will be our third month doing this.
As these volunteers go door to door,
Hi, Mobile Meals.
they meet people that might not have much interaction otherwise.
If they answer the door, we strike up a conversation. If they don't answer, there's a little tidbits on what we do with their meals.
It's especially important to be checking in regularly with more vulnerable people during severe weather. Let's say the power fails.
With it going out, the AC could stop working, no fans, and with it getting hot, or even when we had the polar vortex, anything could happen.
The CDC says older adults might not adjust as well to sudden changes in temperature. That's because they might have a chronic medical condition or are likely to take prescription medication that affects the body's ability to regulate temperature.
In the elderly, as in the young, their health can change quickly.
Mayo Clinic Health System offers at-home hospice care.
On occasion, we work with clients that do not have air conditioning in their home.
When there's a heat advisory, all the nurses are notified right away so they can communicate with high-risk patients.
We make sure that family knows about the heat warning and they have fans in the home, plenty of fluids, and to check on them frequently.
They may get headaches, have weakness, fatigue, nausea, or have dark-colored urine. You should get help immediately if you notice these symptoms.
Especially confusion in the elderly. That's just a critical sign to make sure that they're calling us and that we have a nurse available to evaluate them.
Mayo Clinic Health System also recommends that the elderly have a phone and water source nearby. They should also have access to any kind of mobility aid like a walker or wheelchair nearby just in case they need to get help right away. Mike?
Okay, thanks a lot, Mal. A good reminder to check on your neighbors and loved ones. Some ways to keep cool include applying cold, wet cloths to wrists to necks and armpits, and drink plenty of water and stay away from sugary drinks, alcohol, or caffeine.